AM 1450, FM 99.3, KNSI. Welcome to another edition of Your Health, produced in conjunction and cooperation with the folks at CentraCare. Today, we are talking prostate cancer. Prostate Cancer Awareness Month, the month of September. Did you know 1 in 7 men will be diagnosed with prostate cancer in their lifetime? We're going to talk about signs and symptoms. We're going to talk about screening guidelines and options for treatment. We will talk about a free prostate cancer screening night that is coming up very soon. But first, let's introduce you to our guest, Teri Larson-Johnson, physician's assistant with CentraCare. Teri, welcome.
Thanks for having me.
I promised we were going to talk about this right away. The free prostate cancer screening night. What do we need to know?
The free prostate cancer screening night will be held at the Coburn Healing Center on September 25th from 4:30 to 7:30 p.m.
Who should attend this?
Men who are aged 45 to 70 and they don't have a history of prostate cancer.
What happens at a typical prostate cancer screening?
You come to the Coburn Healing Center and you speak with a provider.
Okay.
They draw blood for a lab test called a PSA, and you have a examination.
Okay.
And then you go home and we notify you by telephone with your result.
That sounds really easy.
It is very easy.
So we've seen commercial after commercial. Real men wear the gowns. Put on the gown. Get yourself checked. Have the cancer screening done. It sounds so icky, but you know what? What have I had? 3 or 4 of them? I'm still standing. It's just fine, right?
Right.
Okay, very good. Is that probably the biggest hurdle that folks have to overcome, is that fear of having an exam?
Possibly, but since the early 1990s, that's when they started the lab test called the PSA, or the prostate-specific antigen, and really was pretty routine starting in about 1992.
Okay.
And since that time, we've actually seen mortality rates drop.
It's working.
It's working.
How about that? Get the test, save your life.
Yes, exactly.
Who'd have thought? Who'd have thought? Let's talk about signs and symptoms of prostate cancer, because I'm sure there are guys that are in their 25, 35 category that are young and virile and, no problem. However, that may or may not be the case, particularly if you have prostate cancer in your family.
Correct. There are usually no symptoms of early stage prostate cancer.
No symptoms?
None.
Okay.
No. So how they do the diagnosis is by screening with a blood test for the PSA, and the higher the number, the more likely that you have.
If there are usually no symptoms with prostate cancer, when you do start seeing something, does that mean, gosh, it's too late?
No, usually they start screening men for prostate cancer about the age of 50.
Okay.
And earlier, if you have a family history of cancer or if you are a Black male.
Okay. So we've talked about the PSA test. We know that it is very simple, right? What we may not know are some of the causes for prostate cancer. What can you tell us?
There's some increased risk factors like a diet high in animal fat or a diet low in vegetables. Being overweight and smoking are risk factors for prostate cancer.
What if you have all 4 of those things going for you?
Then you better come into the prostate cancer screening night.
Hey, let's think about maybe making some changes in that lifestyle, right?
Correct, yes.
When someone comes in and they have the cancer screening that is done and the test results are not what they would like them to be, when you sit down and you talk with folks about prostate cancer, how do you talk with people about prostate cancer? How does the whole education process go?
Well, to start with, if you have a PSA that's elevated or an abnormal digital rectal exam, that's going to be an indicator that there's a good chance that you might have cancer. And so what they would arrange is to have a biopsy to see if there's any cancer in the prostate itself.
Because there may be other reasons why that prostate may be enlarged.
prostate is going to enlarge as you age.
Okay.
That can also increase your PSA. There is a normal elevation in PSA every single year as you age.
Okay.
And so as long as you fall within that guideline, there's no concern. But also having a bladder infection or a prostate infection can sometimes raise your PSA, and then also, of course, just cancer.
That's why when I get those results back on my chart, they have the windows, right? You have this number is good, this number is bad. They want you somewhere in between there.
Correct. Yes. And then remember that every year your PSA may just go up a little bit. Yeah.
Right. When we have questions about these types of things, if I just go to my primary care physician, chances are pretty good they can answer all of my questions that I may have some concerns about, right?
And then if they have an elevated PSA or an abnormal rectal exam, they'd send you to your urologist.
Gotcha. That's
to
how
discuss.
the whole thing works.
Then what do we do? Should we go for a biopsy at that point?
Yeah. More often than not, that biopsy will be the route that will be taken?
Correct. Usually if they're concerned.
AM 1450, FM 99.3, KNSI. We are talking prostate cancer. September is Prostate Cancer Awareness Month. A free prostate cancer screening night is coming up. Men ages 45 to 70 with no history of prostate cancer eligible to receive a free PSA test and an exam. It is happening September 25th. 4:30 until 7:30. You ought to be able to make that. That's a pretty good window. At the Coburn Cancer Center, which is at 1900 CentraCare Circle in St. Cloud. They do ask, please, that you pre-register by calling 320-229-5100. Again, 229-5100. Walk-ins are welcome. We're talking with Teri Larson-Johnson, physician's assistant, about prostate cancer. We'll take just a quick break. We'll be right back. You are listening to Your Health on KNSI. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. We are talking prostate cancer with Teri Larson-Johnson, physician's assistant at CentraCare. September is Prostate Cancer Awareness Month. Teri, let's talk a little bit about the types of treatment that are available for prostate cancer.
Prostate cancer treatment really depends on the extent of your disease. And so what they'll normally do is based on your PSA level, or like we talked about that abnormal rectal exam, if you had that, moving forward with the biopsy. So once you get that biopsy scheduled, they'll maybe put you under with light anesthesia or general anesthesia, depending, and they'll do a biopsy of the prostate. And when you get the pathology results back, that's how you can kind of get an idea if it's low, intermediate, or a high-risk type prostate cancer.
Sure, and from there, that will determine your course of treatment.
Correct. A lot of it is personal preference, or what side effects you're worried about, or if it's a slow-growing cancer versus a fast-growing cancer.
So what do they do to take care of this cancer that's in your body? What are the treatments?
One thing they'll want to do is first kind of determine if it's just localized to the prostate or if it has gone outside the prostate, and so they may do something to start with, like a bone scan or a CAT scan or an MRI, just to kind of see, is it in the lymph nodes, is it in the bones? Those are the imaging that we use to determine that. And then when they look at that pathology, you're going to get a number, what we call a Gleason score, which is going to tell you if it's a low, kind of intermediate, or high type cancer, high risk cancer. And then after that is done, you talk about what type of treatments you want to pursue at that point.
Sure. How about the side effects of some of these cancer treatments? I mean, everyone is pretty familiar with chemo and radiation. Are those the two primary treatments for prostate cancer?
Well, depending on what your
stage of the illness?
your extent is. So if it's a low risk, sometimes people just choose to observe and just watch it and follow a PSA super close. Sometimes what they'll do is surgery followed by radiation.
Okay. What about these? I've heard about these little seeds that can be implanted in the prostate as part of this treatment. Can you talk about that at all?
Though that's referred to as brachytherapy, the
Okay.
seeds, and sometimes that's used with radiation in an intermediate type
Sure.
prostate cancer. And all they do is they insert these radioactive beads or sources in the prostate where the cancer is and around it. And that's also under a little lighter general anesthesia.
Okay, no, I will tell you that was a brand new advancement when I first got into this business of radio broadcasting, right? So they've been doing it for years. How is the effectiveness? Does it again depend upon how you are, but does it have a pretty good rate of recovery or rate of cure?
I think people do really well with that. Again, I think it depends on how much cancer is in the prostate,
Right.
too, and they do determine that with some of the other imaging and testing, too.
What's the name of the doctor that I would be dealing with at this point? Is it a urologist?
You could either go to a urologist or a radiation oncologist. So
Gotcha.
I think it depends on your organization who
Sure.
puts the brachytherapy
You
in.
will steer me in the proper direction.
Correct.
Very
Yes.
good. Very good. So when it comes to side effects of these treatments, what are some of the most common ones that people usually talk to you about or perhaps complain about?
So if you're getting radiation alone, a lot of times there's bladder irritation, frequency of urination, burning,
Sure.
some rectal irritation, maybe a little diarrhea or discomfort with having a bowel movement.
Right. And most of those things I would think would be expected, would they not? I mean, after all, think about what's going on.
Yeah, correct. I always say know where we're radiating, and you can kind of figure out what your side effects are going
Yeah.
to be. Sometimes we add like a shot or an injection with radiation. It, in a way, is like a blocking of testosterone, which is the male hormone,
Sure.
which really is what causes these cancer cells to divide. So what we're basically doing is kind of decreasing what they're using to replicate or duplicate. And so
Sure.
it can decrease the growth of tumor and not make cancer cells. So
Gotcha.
that's kind of how the shot works. So it's called Lupron is one of the names of the shots.
Interesting. Let me ask you this quickly. When someone gets a diagnosis or they think that there is something wrong here and they're going to go a little bit deeper, when that diagnosis comes down the pike, what kind of education happens with patients? Do you folks sit down and go through, oh, okay, here's what we think. It's going to be, could be this, could be that, could be the other thing. That whole educational process.
Yeah, so like with the low risk type cancers, we might call that a Gleason 6.
Okay.
That's the lowest you can get.
Right.
And at that point, you could observe, do surgery or radiation. And then if you had more of the intermediate, which we would call like a Gleason 7, you could do radiation with or without that Lupron injection or radiation with what we call that brachytherapy or those radioactive seeds or source.
It is so interesting because as I'm finding out as we do these conversations, have these conversations with Your Health, two words usually come up very often. It depends, right?
Correct.
And it really does because everything is as unique as the person that is going through it.
Correct. And if you have a high-risk cancer, too, they really would like you to do surgery first as long as you're healthy enough to have it. And then after that, you would do the radiation with that Lupron shot or kind of what I call like a testosterone blocker, or you could do the seeds at that time as
Right.
well.
Interesting. How many people do you folks take care of at CentraCare at the Coburn Cancer Center, including surgery center and up in Alexandria? You've got another clinic up there. So how common is this?
Last year, we took care of 248 men with prostate cancer.
That's
The
all.
diagnosis.
I thought you were going to go 248,000.
No. In the state of Minnesota, there's estimated to be about 1,970 men diagnosed with prostate cancer this year. If you're looking at the whole entire United States, then you'd be looking at about 175,000 new diagnoses of prostate cancer
Okay.
a year. So that number's quite high. And in the United States, it is the second leading cause of death.
Okay, now I have to ask you this. With the aging population, right, we have, 10,000 people hitting 65 every single day. Do you expect those numbers to go up?
A lot of prostate cancer is really slow growing. And so let's say a man didn't screen for prostate cancer, the increased chance of you having prostate cancer in your 70s and 80s is very high, but a lot of times it's slow growing, and so you die of other health problems that you have. So some of it is actually undiagnosed.
Which is why men put on the gown, get the test.
Correct.
Right?
Yes.
What are we so afraid of? What do you think?
I think they feel the test is uncomfortable.
Yeah? Is having babies uncomfortable?
Yes.
Come on, guys.
Yes.
Quit being a bunch of wusses here.
Yeah. And so that part of it, also usually these things are covered by insurance too, because most preventative things are covered.
Right.
And if you don't have an insurance that covers it, then these free screenings are an excellent way to check for that.
All right, folks, here's the deal. We have talked about the opportunity that you have for a free prostate cancer screening. We will take a break. When we come back, we will run through all of that information, who it is for, where to go to have all of this stuff done at no charge. Now, there are some parameters. We will get to those in just a moment. We're talking prostate cancer with Teri Larson-Johnson, physician's assistant with CentraCare. You are listening to Your Health on KNSI. AM 1450, FM 99.3, KNSI. We are back with more of Your Health, our final installment of the day. We are talking about prostate cancer with Teri Larson-Johnson, physician's assistant at CentraCare, the Coburn Cancer Center, the Coburn Healing Center. Two distinctly different buildings, but all after the same thing, making sure that you get better as soon as you can. Free prostate cancer screening night is coming up September 25th, 4:30 to 7:30. Men ages 45 to 70, no history of prostate cancer, please. You are eligible to receive a free PSA test and exam. And again, September 25th, 4:30 to 7:30 over at the Coburn Cancer Center. Now, what is going to happen that night? What should we men be prepared for?
So when you come down on Thursday, September 25th, they will sign you in. You'll have your blood drawn. Mm-hmm. You'll be taken to a room to see a provider. They will do a digital rectal exam, and that is about it. We explain everything that happens right before, like right before you get your lab drawn, right before you get your exam, and then you go home, and then we call you when your results are in.
What's the typical time frame from the time that I have the exam, whether it be the PSA, the rectal thing, or whatever, and the time you call? Is it a day, 2 days, a week, what?
Even like a day or two, because
Really?
we should get the results right away, so it shouldn't be very long at all.
Okay, now how many people do you expect to come into this? 150? You're hoping for the best.
Yes, exactly. We're hoping that men come out and get the free blood test and get the exam.
Now, this is the third year that you guys have been doing this, right?
Correct, yeah.
Sponsored by CentraCare, the Coburn Cancer Center, CentraCare Urology Clinic, and the CentraCare Laboratory Services. And again, this is at the Coburn Cancer Center, which is at the CentraCare Circle. I always call it Sartell, but it's still in St. Cloud, isn't it?
Correct, yes, and it's at the river entrance. I don't know if that helps people find that way.
Right. Just think of Perkins. If you're over there by Perkins, right?
Yes.
It'll be right across the road from there.
Yeah.
Easy to find.
Correct.
There is no reason to not have this done, is there?
Exactly.
Teri, we always hear the phrase, an ounce of prevention is worth a pound of cure. Prostate cancer is something that most American men are going to achieve in their lifetime, if you will, right?
Correct.
Is there anything we can do to improve our chances?
Well, really watch your diet. You want to have a diet low in animal fat and high in vegetables. You want to make sure you keep a nice weight. You don't want to be overweight, so exercise and don't smoke.
I think I asked you that question earlier. In fact, I know I asked you that question earlier, but I was hoping that maybe things have changed since then.
No.
Because I've got 3 out of those 4 things going for me. All right. But I also go get the test. I don't have cancer, a history of prostate cancer in my family, and that is a big deal, isn't it?
Yeah, is a really big deal. It's an increased risk factor.
Right. Hereditary is very important.
Correct.
All right.
Yes.
Again, Teri Larson-Johnson, physician's assistant with CentraCare. Thank you so much for spending time with us today.
Well, thanks for having us.
I want to run through these details on this free prostate cancer screening night one more time. Men ages 45 to 70 with no history of prostate cancer, please, you are eligible to receive a free PSA test and exam September 25th, 4:30 to 7:30 at the Coburn Cancer Center, 1900 CentraCare Circle in St. Cloud. Now, pre-registration is recommended. It is not required, but recommended. Please call 229-5100. That is 229-5100. Walk-ins will be welcome. You've been listening to Your Health, AM 1450, FM 99.3, KNSI.